Recording in progress.
Myself, Dr. Mohan BABU, third year resident in Department of Radiologist, Chettinad Medical College and Research Institute. The topic is dorsal distal wrist pain decoded, MRI clues to distal restriction syndrome versus dequervance tenosynovitis. The intro abstract is intersection syndrome is an uncommon condition caused by tenosynovitis of the crossing point of the second and the third extensor compartment. It should be differentiated from dequervance tenosynovitis because there is a subtle difference in the treatment and prognosis. Introduction. Symptoms include the dorsal distal wrist pain, and the history and clinical examination help limit the differential, but the MRI is significant aid the narrowing the differentials. Distal intersection syndrome relates to tenosynovitis at the crossing of second and third compartment tendons, just distal to the distal tubercle. The following tendons, extensor pollicis longus, occupies the third compartment, and extensor carpi radialis longus, extensor carpi radialis brevis is in the second compartment. If there is a communicating foramen between the extensor pollicis longus and extensor carpi radialis brevis, if there is the communication foramen between the tendons of these compartments, then tenosynovitis may begin to extend from one compartment to the other. In our coming to our case, for the first case, it's a 61-year-old male presented with complaints of pain and swelling over the wrist, no history of trauma. In this case, we find in the MRI water sensitive sequences, water and fluid sensitive sequences, there is soft tissue edema around the area of crossing of the extensor pollicis longus over the second extensor compartment, which contains the extensor carpi radialis brevis and extensor carpi radialis longus. High signal intensity within the extensor pollicis longus, just distal to the listus tubercle, as it crosses over the second extensor tendon, extensor carpi radialis brevis and extensor carpi radialis longus, and is flattened by the overlying extensor retinaculum. There is localized tenosynovitis around this area, and significant amount of increased fluid is present within the extensor pollicis longus, extensor carpi radialis brevis and longus tendons distal in the sheets. There is also thickening and hyperintensity of the dorsal wrist capsule, which is likely due to repetitive sprain. This is inconsistent with distal intersection syndrome. Coming to the case 2, there is a 30-year-old female presented with complaints of left wrist pain in the thumb region, no history of trauma. In these fluid sensitive sequences, we see that there is thickening of the abnormal interceptions, increased fluid signal noted in the first extensor compartment tendon of wrist involving abductor pollicis longus and extensor brevis tendons. Increased fluid noted within the first extensor compartment tendon sheet with extension of mild fluid into the second extensor compartment sheet. Diffuse subcutaneous inflammatory changes noted involving both extensor and flexor compartment of the radial side of wrist. This is inconsistent with the dequervance tenosynovitis with severe extensive inflammation. So there is mainly need to differentiate between these two conditions of dequervance tenosynovitis and proximal intersection syndrome. MRI aids in narrowing the diagnosis. Intersection syndrome is painful disorder of the forearm, mostly in the dorsal aspect. The pathophysiology involves repetitive frictional movements between extensor pollicis longus, extensor carpi radialis longus brevis tendons, causing sheath inflammation, edema, pain, restriction of movements. Predisposing factors involve repetitive friction movements like rowing, PlayStation and computer users, racket sports, etc. And clinical presentation is pain and swelling over the dorsal aspect of wrist region. In severe cases, it can cause crepitus. MRI, we saw the following findings in MRI, and management includes ultrasound guided steroids or 2 to 3 weeks of rest, NSAIDs and wrist splinting. The surgery is indicated for patients who is not responsive to conservative management. These are the following compartments in the extensor aspect of wrist. The first compartment involves the adductor pollicis longus and extensor pollicis brevis tendon. Second compartment, there is extensor carpi radialis longus, extensor carpi radialis brevis. Third compartment, there is extensor pollicis longus tendon. fourth compartment there is extensor indicis, extensor digitorum. In fifth compartment there is extensor digitae minimi, and sixth compartment there is extensor carpi ulnaris. These are the other extensor compartment syndromes caused due to tenosynovitis, the proximal intersection syndrome and the extensor carpi ulnaris tendinopathy, which involves the sixth compartment. Conclusion: distal intersection syndrome is a rare condition caused by associated with repetitive movements of hands and wrists. Distal intersection tenosynovitis may be related to biomedical pulley effect extensively distal to the Lister's tubercle on extensor pollicis longus tendon, as it leaves the third compartment and crosses over the extensor carpi radialis tendon, as well as the constrained effect of extensor retinaculum. These anatomical features determine the presence of characteristic MRI findings effective for diagnosis. MRI is crucial for accurate localization and diagnosis, allowing differentiation from other causes of wrist pain such as the de Quervain's tenosynovitis.